erectile dysfunction. This is disorder of the males in which the patient is unable to get full erection for intercourse. The penis is not rigid and hard enough to get the full orgasm. It may be partial or complete, temporary or permanent one. It is of two types: physical, psychological. Mostly it happens above the age of 50, but it is also disease of youngster or the teenagers. Mostly the teenagers are suffering from psychological erectile dysfunction disorder because almost they are fully fit physically, but they are suffering from stress, depression, and anxiety neurosis. Second is physical one. It is of two types. The pathogenesis is neurogenic and muscular one. In neurogenic, the sexual arousal emotion stimulate the brain center, sex center in the brain, which transmit impulses through the spinal cord to the nerves of the penis. In this circuit, there is disorganization, disability to convey this circuit one due to dementia, Parkinson disease, Alzheimer's disease, multiple sclerosis, spinal cord lesions and tumors, and peripheral neuropathies. These are the causes which produces disturbance in neural transmission of the sex emotion or the sex electronic impulses which are produced in the center of the brain, sex center of the brain. These stimuli, neural one, produces nitric acid, nitric oxide, nitric oxide, which is a chemical that produces relaxation of the smooth muscles of the vessels of the penis, due to which there is dilatation, there is excessive flow of the blood in the erectile tissues. Corpora, corpora cavernosa, there are two sets, left and right corpora. So they are engorged one with the blood, and there is erection and the rigidity in normal cases, in physiological cases. But when there is disorder, the circuit is disrupted, so the blood circulation is impeded or reduced one, due to which the penis is not rigid and flaccid one, and the person cannot perform completely or partially the sexual function and to get attain the normal orgasm, which is near about the period of 5 minutes. So this is a neurogenic cause. Next is the muscular one. In this case, as I have explained, nitric oxide produces relaxation of the smooth muscles of the vessels, blood vessels. They relaxes, and there is dilated one, excessive flow of blood in the erectile tissue, sinuses, they become engorged with blood, the penis stretches one, elongated, get full rigidity and hardness to perform the sexual activity. In this case, there is sclerosis, atheroma formation, plaque formation in the vessel wall. The vessel walls of the penis become narrowed one. So, though if the neural circuit is normal one, production of nitric oxide is normal one, but the vessels they are narrowed one permanently due to the atheroma formation, due to high blood cholesterol level. And this is a precursor towards the heart attack. I mean that is CAD, coronary artery disease. Because penile vessels are short ones, they indicate their deposit of the plaques. So these plaques also be formed in the large vessels of the heart, and that may be precursor to the heart attack, that ischemia of the heart. So this is an indicator one. If the person is Impotence, I mean sexual disorder, is a person suffering from erectile disorder. So that indicate there is vascular pathology one. So these two main factors are. Others are secondary factors: obesity, diabetes mellitus, hypertension. Then there is, I mean, the sedentary habits, excessive use of alcohol, smoking one. All these factors, they also produce or participate in the production of erectile dysfunction. So these are the various etiological factors that are responsible. Pathophysiology of erectile dysfunction or impotence. This is a disorder in which the person cannot attain and maintain erection of the penis for sexual intercourse. The penis of human being consists of three erectile tissues: corpus spongiosum, in which urethra is located, then two set of left and right corpora cavernosa. The corpora cavernosa are actually the erectile tissue, in which there are penile vessels, nerves, and the smooth muscle connective tissues. Actually, it is the most important part of the penis. Then there are nerves, sensory nerves, glans penis, which has a very delicate network of sensory nerve fibers. So when sex arousal is produced by the person himself thinking about the sex or the physical contact with the penis, by the opposite sex partner, or by self manipulation by hand. So these produces stimuli that runs through the sensory nerve to the sex centers in the brain. Then sex center interpret these sensations and transmit orders in the form of electric currents through the nerves fibers, which travel through the spinal cord up to the penis. So when sex arousal is complete one, and the understanding of the sex desire is interpreted in the sex centers, they produces orders through the nerves, which goes to the penis. The nerves ending then secrete and produce nitric oxide, which is a very important component in maintaining the erection of the penis. This nitric oxide produces relaxation of the smooth muscles of the blood vessels, due to which the vessels they are dilated. When they are dilated, blood gushes in the erectile tissues with force. These erectile tissue has spaces which collect the blood, and they are swollen up, and the penis is erected into full position. Normally the full in erection, the length of the penis is from 5 to 6 inches. Rarely it may exceed above 6 inches limit. But however, I have seen in patient reaching up to 7 inches. But they are abnormal. Though it is in present in normal person, but I consider they are inhuman one. Normal length of the penis should be 6 inches, around 5 to 6 inches. Now, when there is erection of the penis, person can perform, if he is normal, in sexual strength can perform his sexual desire up to 5 minutes. That is the orgasm or the climax of the sex satisfaction. That is the period is 5 minutes. So this process is a physiological one. But in case of erectile dysfunction, there is disruption in the transmission of the orders from the brain, sex center to the nerves of the penis. There is pathology, disruption, distortion due to certain pathologies, I mean dementia. Then there is Alzheimer's disease, Parkinson disease, spinal obstruction due to tumors or the disc diseases, pathologies, spine protrusion, disc protrusion, spine deformities. So this produces obstruction or impingement over the concerned nerve fibers. So this is a neural factor. There is obstruction in the nerve pathway due to which nitric oxide is not produced and the blood circulation is not normal one. Next, if it is a normal passage of the nerves orders in the person, then next is there is pathology in the nerve, blood supply, blood vessels of the person. There is plaque formation, atheroma due to high cholesterol, bad cholesterol in the blood, instead of deposition of the small vessels of the penis. So they are narrowed one. They become rigid. They can't expand. So in spite there is normal production of the nitric oxide, there is no benefit because the vessels they are narrow one, so blood circulation cannot be enhanced. The blood circulation is not boosted up. So this is a second factor for erectile dysfunction. These are the two main ones. Other factors or etiology factor, they are the secondary ones. Next is the function of the male hormone, testosterone. Testosterone hormone produces sex arousal. I mean desire for sex function is produced by this hormone. And this hormone is produced by the cells of the testes. But the actual function in the penis for erection, rigidity, firmness, hardness of the penis is by the nitric oxide produced by the nerve endings and nerve fibers supplied in the penis. So this is a physiology and pathology in erectile dysfunction or ED. Now the secondary causes excessive use of alcohol, excessive tobacco smoking, then sedentary habits, certain prescription medicines, they are also responsible. I mean thiazides, antihypertension medicine, antihistaminic, antidepressant, anti-anxiety medicine and drugs, they also produce or contribute or enhance this disorder, erectile dysfunction disorder. So these are the main factors, especially the foremost factor is diabetes. In diabetes, there is a peripheral neuropathy, especially in the penis nerves, so they become numbness and sensations are impeded. They can't catch the orders from the main center of the brain, so they are weakened one, due to which the production of nitric oxide is diminished and lessened. So diabetes, obesity and sedentary habits, they are also the causative factor for erectile dysfunction. Treatment of erectile dysfunction. Nowadays, three medicines are widely used throughout the world for the treatment of the erectile dysfunction. Sildenafil, vardenafil, then there is tadalafil. These three drugs, they are used in the form of pills, and they are very effective and produces satisfactory results in the patients. Though these medicines, they produces acceleration in the function of the nitric oxide, due to which the circulation of the penis is increased and there is erection of the penis due to this stimulation. Next is the treatment by the three medicine combination injection, that is prostaglandin, papaverine and phentolamine. This is three medicine combination injection is given by the minute syringe or minor syringe in the lateral side of the penis, and this is very effective and immediate effect is produced within 5 minutes. There is erection and that lasts for about 2 or 3 hours, and these are widely used by the diabetic patients. So in addition, when there is deficiency of the hormone testosterone, if that is indicated by the blood estimation, then there are also the capsules of testosterone. There are injections for intramuscular use. There are sprays, ointments. So these are also used for the treatment of the erectile dysfunctions. In addition to this medical treatment, there are mechanical devices which are manufactured for the treatment of this ED. Vacuum pump device, which has a tube. Penis is placed in this tube. There is a pump which produces the vacuum, and due to this vacuum production, the blood is gushed, as that is pushed into the vessels of the penis. So due to this increase in circulation, there is transitory or temporary increase in the erection of the penis. So it is not a permanent treatment, but it is for the time being or the temporary one. Next one is, that is penile implants. These comprises of two rods which are placed on the sides of the penis. There is a reservoir by the urologist, by surgery put or fit the reservoir in the sacrotal cavity. There is a pump, a button for on and off. So in this, when you have to perform the sexual function, then you pump the system, the blood which is present in the reservoir, that gushes into the rods, and those rods, they become erect, and that pushes the penis upwards in erection position. So it is a only affected for the person who are above 60 to 80 years range. So these are the mechanical devices which are produced for the aged persons who are above 60 years by the, and these are performed by the urologist, trained urologists, they produce it. Then there are, if there are vascular pathologies, they are produced by the surgeons. Vascular repair is done to improve the circulation of the penis. So these are the various steps which are adopted by the patient after the consultation with the, urologist. They advise the various medicines which I have already explained and I have already mentioned, or the mechanical devices or the operative surgery ones. So these are various steps which are used for the eradication of the erectile dysfunction. Diagnostic steps for erectile dysfunction. Initially, healthcare provider take history of the patient. From the history of the patient, it is concluded whether it is a temporary or a complete one. So afterwards, the doctor examine the secret parts, the scrotal area, structure of the length of the penis, any deformity, any aberrations, varicose veins in the scrotal area, or epididymo orchitis. These are the various pathologies which has to be observed by the examination. Then we proceed on to the laboratory tests. Blood test for cholesterol level, testosterone level, then sugar level. So because diabetes, high cholesterol level and the low hormone level, they are the contributing factor towards the erectile dysfunction. Then we proceed towards the various procedures like CT scan. Then we also perform the ultrasonography of the penis structures. By these ultrasound or sound waves, we observe the blood vessels of the penis, nerves, soft tissue, smooth muscles, and the vessels of the penis. If there is any plaque formation, obstruction, whether there is any other pathology in the sinuses of the corpora cavernosa. So these are also examined by the ultrasonography, by the sound waves energy. Next is MR angiography. This is a magnetic field and the energy process by which we also study the detailed structure of the penis, in which corpus spogiosum, urethra, corpus cavernosum, vessels, smooth muscles, nerve supply, all these are studied in detail by this method. So these methods, they help in the diagnosis of the pathology or the causative factor for the erectile dysfunction or the impotence. So mostly it is psychological in the teenagers and physical impotence in the persons above 50 years. So in this way, we have to decide whether it is a complete disorder or whether it is a temporary one. Accordingly, we adopt the medical treatment and the mechanical devices are advised by the urologist. So for these, there are other factors, for example, psychological factors. For that, we have to consult psychiatrist for maintenance or management of the stress, anxiety, and depression depression crisis in the patient. So these are the various steps which are adopted for the diagnosis of the erectile dysfunction.